Hi, my name is Mark. I'm the creator of Return Pilates. As well as being a physio, I've been teaching clinical Pilates for over 15 years. In this video, we'll share some information about how some systems in your body work to help you get more out of your Pilates classes. I've chosen these specific things as they are often misunderstood or misinterpreted in exercise settings. This video should help you learn more about your body and make it clearer what our instructors are guiding you to do during your classes, helping you get the most out of each session.
The word core is a term commonly used in many exercise settings. It is often used to describe just the abdominal muscle group. However, there is a whole system of muscles that work together to create your core. The core group includes your deep abdominal muscles, obliques, the iliacus, small muscles in your back, the diaphragm muscle, and the pelvic floor muscle. This muscle group works together to create efficient movement, support your spine and other parts of your body as you move through activity. In our Pilates classes, we guide you to use your core correctly, which allows your muscles to safely strengthen and improve your control. The pelvic floor is a critical part of the core muscle group. It lies at the bottom of the pelvis and is positioned like a bowl. It has many functions in the body, including controlling the bladder and bowel and supporting the internal organs. Correctly activating the pelvic floor muscles requires a gentle squeeze around the openings and creates a light internal uplifting feeling inside of the pelvis. It should not involve a bracing or a gripping sensation in the leg, bottom, or abdominal muscles. As well as learning how to activate the pelvic floor, it's also important to learn how to relax it with each repetition or between exercises. Exercising regularly can strengthen the pelvic floor and make it work more effectively as a part of the core muscle group. The main breathing muscle is the diaphragm, which is an umbrella-shaped muscle that sits within the rib cage. The way your rib cage moves when breathing can influence which muscles you use within your core. Sometimes forced breaths or pursed lip breathing can result in overactive muscles or imbalances in your core muscle group. Keep your breathing relaxed. Visualize that you are trying to expand your rib cage out to the side with each breath in. We call this bucket handle breathing. This type of breath pattern will enable you to breathe effectively without compromising the function of the abdominals as they activate during exercise. All of these elements have an important role in creating an efficient and functional core group.
Another important skill to help your body move well is to learn to control the position of your shoulder blades. If the muscles around your shoulder blades function well, this will help reduce the pressure and stress on your neck.
Your shoulder blade is the obvious triangular bone that lies in the upper back. It is the same piece of bone that forms the socket in the ball and socket part of your shoulder. When you lift your arm up above your head, your shoulder blade will contribute to almost 40% of the total movement. Because your shoulder blades move with your arm, the idea of dropping the shoulders down from the ears and back to open the chest can impair the normal shoulder blade movement. Instead of pulling your shoulder blades back and down, it's better to control your shoulder blades in a neutral, mid-range position when you perform arm exercises.
So, with all of that information, now is a great time to practice some breathing and activating your pelvic floor, so your body is familiar with it for when you begin your classes at the Return Pilates studio.